Despite all the latest technology, the rate of moms dying during childbirth is rising in the U.S.
Statistics show this is not happening to all groups. Seth Kaplan explains.
The United States has a rising maternal mortality rate compared to other highly resourced countries.
That's overall, and some expectant mothers living in America might as well not be living in America, but rather in countries around the world where things are much worse. This is Black Maternal Health Week. Why a week especially for Black expectant mothers?
Black women are 3 to 4 times more likely to die in childbirth than their white counterparts.
Dr. Cherie Livingston, the OBGYN chair at UPMC Magee Women's in Lidditz, says it's not mostly because of the quality of the health care they're getting.
50% of health outcomes are attributed to social determinants of health. 20% of health outcomes are attributed to what we as healthcare providers do.
In other words, people like doctors and nurses are important, but when something goes wrong, it's even more likely to go wrong because of things like unhealthy community eating habits.
You go, into any American city and you see stores that have foods that are just not healthy. And so, unfortunately, things like social determinants of health, where people live.
One example, which came up during this event Wednesday, well, think about all the usual healthy things people couldn't do during the depths of the pandemic, things like routine health care. And then listen to this.
The maternal mortality rate in our country rose about 40% in 2021.
It makes you feel hopeless when you're talking about the statistics. Imagine the people who are living that life. But there are solutions.
Solutions like society doing a better job taking care of all women, she says, but also things expectant mothers can do themselves, like asking this specific question of their doctors.
What can you and I do together to help keep me safe and have a beautiful, safe birth?
And then following the plan together. Seth Kaplan, ABC 27 News.